You get up from the bed, you get a sharp shooting pain in your sole of the feet, and you wonder why this is occurring. Some of you are facing it since weeks to months to years and sometimes decades. Well, my friends, just to reveal to you, most likely what you're facing is plantar fasciitis. Many of you know it, some of you don't. Some of you are not approaching a doctor or an expert because you feel it's a part of life which has to be tolerated. Well, it doesn't have to be. I am Dr. Gaurav Gangwani, a board certified equivalent interventional radiologist. Today I am going to be talking about this condition and its minimally invasive treatment options. Plantar fascia is a fascia that covers the sole of the foot, and it's a very protective layer and a padding which helps you do a lot of things and movements without hurting your bones or structures, tendons, ligaments, etc. With time, due to wrong footwear, wear and tear, sometimes inflammation in the body, it undergoes micro tears and inflammation, resultant inflammation, with latest studies showing neovascularity or increased supply to the inflamed area, which leads to a very sharp shooting, strong pain, sometimes refractory or resistant or recurrent despite everything that you do. There are many traditional options. Initially, when it starts, we try footwear change, some basic stretches, massages and strengthening exercises. We try barefoot shoes or foot arch corrections to try to unload the pressure on it. But if nothing works, you have to try other options like initially minimally invasive options like steroid injections or PRP injections for regenerating some of those micro tears or reducing the inflammation. Sometimes even that doesn't work, and there orthopedic may offer you a surgery for a plantar fascia release. Unfortunately, that surgery does lead to instability, which is complained by many patients, and I would say that should be kept as a last resort. But then these patients did not have any choice because it was hellishly painful and recurrent, affecting quality of life. So as a trade-off, knowing that it can have complications, they do choose to go for it. Today, luckily, because of Japanese scientist and Dr. Yuji Okuno, we have a technique known as TAME, transarterial musculoskeletal embolization, where we can go through angiography, either your foot or through your thigh, into the blood supply supplying the plantar fascia. And we can inject a particular agent known as imipenem cilastatin. Originally an antibiotic, but a very strong anti-inflammatory agent which does not harm the normal blood vessels. And we inject it super selectively into the plantar fascia, especially the inflamed vessels, which reduces the inflammation to such an extent that by 6 to 12 weeks, you are nearly cured of the pain completely and off analgesics or painkillers, despite changing nothing else. This has worked for knee arthritis, for frozen shoulder or adhesive capsulitis, tennis elbows, golfer elbows, and a lot more conditions. And the latest kid on the block is plantar fasciitis, for which this was used and it is working wonders. The clinical results which have come forward show success rates in one session as high as 93 to 99% if done correctly, complication rates nearly zero or zero practically, and durability of at least 2 years in short-term data, which we have followed up these patients. We have not seen any recurrences yet. So it is a beautiful, I would say, miraculous minimally invasive intervention, and it works wonders for refractory or recurrent cases where the basic conservative measures are not working. So what do you expect during this? On OPD basis, you can visit a clinic. No need for admission. They can take a tiny puncture either in your ankle. The results go down because that's a generic blind puncture, or you can do it angiography guided through your thigh, groin. Take a wire, navigate it under ultrasound guidance into the blood supply of the plantar fascia, inject these particles, try to reduce the inflammation, and just take a follow-up angiogram, confirm that you have done that, and come out. Remove everything, put a pressure, gentle pressure and a small bandage. By 4 hours, the patient can walk home. We follow it up. Like I said, the technical and clinical success rates are excellent, nearly zero complication risks, decent durability with not much recurrence, no scar whatsoever. It's completely bladeless, sutureless, scarless, and a very good recovery profile. You can start work the next morning. You may have some unease and some inflammation, I would say post-embolization syndrome in your plantar fascia in your foot, but other than once that resolves automatically, it's not even a complication but a sequelae, you will feel much better. So I hope this video helps and raises, and if you have tried everything else, things are not working out, do meet an interventional radiologist who are expert to perform these. I will be very soon placing videos on the end screens which might help with more knowledge about similar conditions. Don't forget to subscribe so that you don't miss them. Stay safe, stay empowered.